Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Inhaler-related emissions increased 24% from 2014 to 2024. Break. In the past decade, inhaler-related emissions have increased in the United States, according to a study published online October 6 in the Journal of the American Medical Association. Break. William B. Feldman, MD, DPhil, mile per hour, from the University of California in Los Angeles, and colleagues quantified the magnitude, sources, and social costs of inhaler-related emissions from 2014 to 2024 in the United States in a serial cross-sectional analysis. Emissions were estimated from all inhalers approved for asthma or chronic obstructive pulmonary disease using aggregated dispensing data. Break from 2014 to 2024, a total of 1.6 billion inhalers were dispensed in the United States, generating an estimated 24.9 million metric tons of carbon dioxide equivalents, MTGO2e. The researchers found a 24% increase in annual emissions from 1.9 to 2.3 million MTGO2e from 2014 to 2024. During the study period, metered-dose inhalers were responsible for 98% of all emissions. Emissions were concentrated among short-acting indicirc and SUP2 agonist, inhaled corticosteroid and number 147, long-acting indicirc and SUP2 agonist, and inhaled corticosteroid classes. 87% of total emissions were accounted for by albuterol, budesonide formoterol, and fluticasone propionate inhalers. The emissions had an estimated social cost of $5.7 billion. Break inhalers add to the growing carbon footprint of the U.S. healthcare system, putting many patients with chronic respiratory disease at risk, Feldman said in a statement. On the upside, there is tremendous opportunity to make changes that protect both patients and the planet by utilizing lower emission alternatives. Break. One author disclosed ties to the pharmaceutical industry, a second author served as an expert witness in litigation against inhaler manufacturers. Break abstract/full text, subscription or payment may be required. Break editorial, subscription or payment may be required. Break disclaimer, statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary. Less than /speak. Speakatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. Read this next. Budesonide formoterol more effective than salbutamol for preventing asthma attacks in children. Break, in children aged 5 to 15 years with mild asthma, budesonide formoterol reliever monotherapy is superior to salbutamol for preventing asthma attacks. Break children with chronic conditions more likely to have food insecurity. Break Friday, October 3, 2025, children with chronic conditions are more likely to have food insecurity, according to a study published online September 26 in JAMA Network Open. Ninui. Break Op. Routine asthma symptom screening improves pediatric diagnoses. Break Friday, October 3, 2025, routine screening of children for asthma symptoms in a population with high prevalence can improve diagnoses, according to a study presented at the Break. More news resources for MedWatch. Drug alerts daily. Med news for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.